Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to Ask the Pediatrician Hour. I am Baby Boyde. I'm a pediatrician, and it's my pleasure to be here today. Ask the Pediatrician Hour is a program where we tend to discuss important issues that affect the health of our children. And the program is brought to you by Ask the Pediatricians Foundation, a registered nonprofit in Nigeria. We're committed to the health and well-being of all children globally, but especially in Africa, where most of our children still die from preventable conditions. And we do that through our health education and information program online like this one, and also through community medical outreaches to indigent communities. So I want to specially welcome you for joining me today, whether you're watching on Facebook, YouTube, or Instagram live, or you're listening to me on Fresh Waves Radio or Ask Dr. Bami ATP podcast. Thank you so much for joining me today. And just to remind those of you who are joining for the very first time that you can still watch all these episodes and the past episodes of this program on the same platform you're watching right now, especially on Facebook, YouTube, and on Instagram. And you can also listen on the podcast as well. So don't feel like you have missed anything. You can always go back and watch them. And if you have any questions based on this program of today or even our past episodes, you are welcome to ask your questions on Ask the Pediatricians Facebook group. Our Facebook group is available 24/7, Mondays to Saturdays, and you're going to get answers from a pediatrician's perspective. So feel free to ask us any children health issues, and we'll do our best to support you by giving you evidence-based answers. So thank you so much for joining us today. And if you were with me last week, I started the series on question and answer session on autism spectrum disorder because April is the Autism Awareness Month. The 2nd of April is Autism Awareness Day, but the whole month of April is devoted to creating awareness on autism spectrum disorder. And coincidentally, I'm wearing blue today, so I guess I'm lighting it up blue for autism. So last week we started talking about autism, and I was addressing some of the questions that members of Ask the Pediatricians Facebook group and a few other Facebook groups that I do support sometimes ask about autism. And I felt that there are many of you who are our listeners or those who will be watching us who also would like to know the answer to some of these questions because they are very important questions. They are about making sure we understand what autism is all about and how we can support our children who have autism. And if you have not watched the last week episode, I want you to watch it first and then you can watch this second episode. And of course, immediately I started answering a question, I was not able to go too far. So I know that I have to come back and do a second session and answer a few more questions today. And I hope I'll be able to go further today. But after today, I may not do another section on autism for this year. But if you still have any questions on autism, feel free to send your question, like I said earlier, to our Facebook group, Ask the Pediatrician Facebook group. You can't miss our Facebook group. You used to get on Facebook. We have one of the largest parents Facebook group with over 720,000 members. So you will definitely know you're in the right place, because I know we have some people trying to copy, but they don't have as much. So you will definitely know when you are in the right Facebook group, and you can post your questions there and patiently wait for us to answer your questions. So thank you so much for joining me today. All right, I'm going to start by posting this question, which I think is a good way to start, so that I can again explain or reintroduce to us or remind us what I said last week about autism spectrum disorder. But I won't go into too much details. Like I said, if you want to know more, I think I did a lot more explanation on what autism is last week. So feel free to watch autism spectrum disorder question and answer section part 1 last week. It's still available. All right. So the first question I'm taking today is, please explain autism to me in a layman's understanding. And that's what we try to do on Ask the Pediatrician Hour on all our platforms. We're trying to come alongside parents and help you to understand all these medical jargons in a very simple way. So I love the way the person asks the question is about understanding autism in a layman's way. So basically, autism, like I said last week, is a neurodevelopmental condition. It's a condition that has to do with the brain. It has to do with the way the brain is wired, and usually it will start when somebody is a child, and it may become more manifest as they get older, but it has always been there from childhood. And the main challenge with people who have autism is that they have difficulties with interacting with people. They have difficulties with certain behavior that they may have to do over and over again, or do it in a particular way. And sometimes they also have difficulties with making friends, things like that. So those are the things you see in people who are on the autism spectrum. So it's more of understanding emotion, interacting with other people, and then liking things to be done in a particular way. And sometimes they have to do it over and over again, or the way they interact with the environment may be different. So that is what autism is all about. It's a condition that has to do with the brain. We don't know the particular cause of it, but we can see the features. And when we see those features, we know we can explain these features only by autism spectrum disorder. It is a big spectrum. When we say something is a spectrum, it means there are different variation of it, and everybody may be slightly different, but everybody will always have those core features, the difficulty with social interaction, social reciprocity, difficulties with making friends and things like that, or social situation. They may be socially awkward, and then liking things to be done in a particular way, repetitive or in a rigid way, and some way they do things, interacting with the environment may be slightly different. So everybody will still have that, but the degree to which it manifests may be slightly different. So some people are on the milder end of the spectrum that you may even find difficult to know, and they are otherwise intelligent, doing everything else, whereas there are also children or other people on the other hand who may not be talking at all, and who have severe manifestations of some of the things I've mentioned as well. So it's a huge spectrum, and there is no one particular behavior that will say this is autism, and there's no one particular behavior or feature that will say this is not autism. So, which is, I think, what many people struggle with when it comes to autism. We don't have like a blood test to diagnose autism. It is basically at our observation, and we have a set of criteria that once the person take 1, 2, 3, 4, all these criteria, then we can give a diagnosis of autism. So that's basically what autism is in a layman's language. All right, let's go to the next question. Say, hello, Doc. Aside from regression of speech from an autistic child, is it possible for an autistic child to have regression in other skills and abilities like writing, feeding oneself, etc.? Thank you so much for this question. And for those who don't understand the word regression, regression simply means a child has started to do something before and then suddenly they stop doing that thing. So for example, a child maybe at the age of 1 year starts saying mommy, daddy, then all of a sudden they went silent and they can't say mommy and daddy again. So we will say in medical jargon that the child has regression of the milestone of speech milestone. So what this and regression of milestone is one of the red flag or one of the first points to autism spectrum disorder. In fact, there are very few things that will cause a child to lose milestones, except the child has some problem like in the brain, like physical problem or something going on in the brain. Otherwise, if a child is always not sick, nothing, and they suddenly lose their milestones, one of the things we will think about is autism spectrum disorder. I'm talking of the toddlers and infants. So speech regression, in other words, a child will start talking and then suddenly they just went silent and they won't say anything again, though eventually they may say eventually start talking again. That is one of the hallmark or red flag for autism spectrum disorder. We call it autism regression. And however, just like this person is asking, it's not only speech that the child can regress, the child can also lose other skills, including writing, feeding, and all that. So it's not only speech, but I guess the speech is the most common of them all. However, we also need to bear in mind that autism on its own does not mean a child will not be able to do certain things. Autism, like I mentioned last week, for those of you who were here, sometimes occur alongside other developmental conditions. So for us in developmental pediatrics, we tend to have multiple conditions happening at the same time in the same child. So some children will have autism and also what we call global developmental delay or global developmental impairment. And some children will have autism and not have global developmental delay. And I think some parents whose children do not have global developmental delay, in other words, they are doing every other thing else apart from maybe the speech, social interaction, and those behavior. They sometimes worry about, my child is very good with sucking, my child is very good with this and that. My child is very clever, very intelligent. And as if, why should a child who is that clever, intelligent, have autism? A child can be very clever. In fact, some children with autism are super, super intelligent. I've seen toddlers, like 2-year-old. I think there's one with an Instagram sensation now, who can do any kind of sums, numbers, multiplication, division at age of 2. That's a super clever child. Some of those children actually have autism, So a child can be super clever and still have autism. Okay. So don't think that because my child is doing all developmental milestones are fine and everything it does not mean a child cannot have autism. So autism is not the same thing as global developmental delay, but some children with global developmental delay, we also have autism. So you can have autism and developmental delay coexisting together and all that. So but regression of milestones can occur in autism, and it doesn't have to be only speech. It can occur with other milestones as well. All right, this next question is very similar to the first one. Does autism affect the ability to write? The answer is no. Autism on its own has nothing to do with the fine motor skills. But just like I just said now, a child with autism can also have other comorbid, other associated conditions that can now explain that. So if a child is struggling to write, the child may have fine motor delay, which can be on its own, or it could be part of the global developmental delay or learning difficulties or intellectual disability. So it is not the autism affecting the child's ability to write. The autism is there. The child's ability to write has to do with another diagnosis that is coming alongside coexisting with the autism. All right, so that is that. And somebody say, how can you get in touch with you for physical consultation for an autism child? Okay, for those who are part of our group, they know how to contact us. Just send us a WhatsApp message and we can tell you if you want to see any of our professional for autism assessment, how to go about it. All right. Now, the next question say, what is autism, Dr. Baby? I think I've explained what autism is. Autism is a neurodevelopmental disorder that affects the child's ability to interact and also makes them to do things in a particular way. And they may also affect, they may have some repetitive or restricted kind of behavior. So that is what autism is in summary. So then the next question is, what is the treatment? That's a very big question. All right. Like I said, we don't, I always like for parents, I always just like to say we don't know the cause of autism. I know from my doctor's colleagues, it's not as simple as that. We know that autism has to do with the brain. It has to do with the way the brain is wired. We think there are some genetic influence. We think there are some environmental factors. I'm not going to go into details of that because parents are not interested in all those jargons. Parents just want to know how to help their child. But I'm going somewhere with that information. What that means that when you don't know the cause of something or what went wrong, then there's nothing for you to fix actually, which is the issue here. So it's conditions that we know what is wrong. Maybe the iron is low in anemia. We just give you iron and that's it. The issue. Or in malaria, we know is the parasite in the red blood cell. So we give a drug that will take care of that parasite and that's the end of malaria. But autism is not like that. So we don't know what really went wrong in the brain, but we know there's something going on in the brain that affects children's ability to interact or want to do things in a particular way. So because of that, we don't have like a specific drug or any treatment for autism. As at this morning that I'm talking to you, there is no specific medication for autism. Autism is not the only condition that we have in that category. There are many conditions that we don't treat. We don't have specific curative drugs or anything for, but we can manage them. All right. So management. So when we talk of things like autism, we talk about management. So management is different from treatments in the sense that I know treatment can be part of management, but treatment kind of sometimes give you the impression you are going to give something and then all the problem will go away. But management means you do something to make it better, even though everything may not go away. So what we do with autism is to look at what are the difficulties the children are having and how can we help them. So we don't have any particular drug or anything that we're going to give for children with autism, but we can support them and we can manage them. So what are the difficulties that children on the autism may have? Some of them may have problem with talking, like they can't speak at all, or some children can speak but they don't know how to have conversation back and forth, or they can't read the room, they don't understand the social aspects of communication. So we can teach those children, we can do speech therapy to help with their speech. Some children have issues with their behavior. Maybe they don't give eye contact, they want to do things repetitively and all that. So we can do some form of behavior therapy. All right. So there are people that are trained as behavior therapists and that they can help. Some children struggle with their school and education. So we have specialist teachers that can support such children. Children that may have issues with their fine motor skills or what we call social sensory sensitivity. Our occupational therapists can help those children as well in that aspect. So basically we try to focus on what are the difficulties this child is facing and we try to address it. But more importantly, we try to we try to empower parents to understand autism. And I think that is actually what I'm doing today, because I think the most important thing first is for people who are around our children or adults with autism to understand what autism is, because sometimes people don't understand. For example, a child with autism may have a meltdown, and then everybody is giving the mom the look like you are not a very good mom, or you are not disciplining your child, or your child is spoiled or naughty, and which is not the issue here. And sometimes for parents, the approach we use with some of our other children, and they are fine. Sometimes it may not work with children on the autism spectrum. And I know some of my parents always feel as if they allow the children to get away with many things, and the other children begin to wonder, why is the child getting away with many things? So we need to let parents understand first, to understand what autism is, to understand why sometimes the children behave the way they do, not because they are naughty, not because they are rude. For example, a child with autism may not look at you. It's not because they are rude. That is just autism. They don't tend to give eye contact. Children with autism may not like you to give them hugs, or you want to give them hugs, even their dad or their mom, and they just push you away. I've seen mom who literally breaks down in the consultation because they feel so bad that their child will not even want to hug them or give them a kiss. I mean, something so simple as that. They really, but once the parents understand, it's not because my child does not love me. It does not mean people who are on the autism spectrum don't have affection or they don't have emotion. It's just that the way they show it is different. So they may not want to show it by giving you cuddles or hugs. Some of them do. They can even go over the top and cuddle everybody. Like some of my kids want to give me hugs every time, but some will not do that. So also understand why they do that. You only understand this is autism, then it's make it easier to accept. I know it doesn't fix everything, but it also helps. And then when people know that this child is on the spectrum, because sometimes parents find it hard to tell people that my child has autism, and because they find it difficult to tell people that their children have autism, and autism is one of those disability we call hidden disability. So you will see a child who looks perfectly fine, and you wonder there's nothing wrong with this child. So, and then the next minute the child is having a full-blown meltdown, and you can't seem to understand what is going on. It could just be as simple as the fact that maybe somebody has put on a perfume that the child finds irritating, or there's a particular noise, or the hoover has come on, and it's just that sensory sensitivity kicking, and the child can go on having a full meltdown. People can't just understand what is going on, and sometimes our parents feel so embarrassed. How many people do you want to explain to that my child is having an autistic meltdown or something like that? So it's about helping parents to understand, helping families, people, even siblings understand why my sibling, sometimes siblings feel it as well. Like my brother doesn't want to play with me. He doesn't want to, do anything with me. He doesn't want to share anything with me. So helping everyone to understand this is autism. This is how people who have autism deal with, and how they manage things. And once we understand all that, we are better positioned to support people on the autism spectrum. I recently gave a talk to our children and youth workers in the church on how to make our church autism friendly, because we have some children in the church who are on the autism spectrum, and youth workers, they just don't know how to manage them, and little things that we take for granted can affect those on the spectrum. The lights in the church, the noise, in our services, most of this is so noisy and all that. For children, you think you make it noisy, but children on the spectrum don't like that. So sometimes you have to be sensitive. You may have to create their home room, separate room, or try and tone down most of those other issues and all that. So it is about everybody understanding autism, understanding why and how people with autism may be different, and making that adjustment. That is it, making that adjustment so that people on the spectrum will be welcome, will feel accepted, and will be able to feel comfortable around us. And I think for me, that is very key. So one of the first things we want to do after giving a diagnosis is to make sure parents go for all these autism courses about understanding what autism is. And also we talk about support groups, and we have a lot of support group on Facebook, on the internet. We have Autism in Nigeria and beyond. All these Facebook groups, very lovely, because you see other parents who have gone through this journey or who are going through their journey. And sometimes when you feel like, am I the only one going through this, it can be quite overwhelming. But when you see that you're in a community who also have understood this, some people have gone through it for 30 years. Thank God for social media now. So people are beginning to blog, and people are beginning to do videos, YouTube channels, TikTok channels about their experience with their children on the spectrum. Very lovely. And other parents who now have the scenario, they're able to know that, oh, wow, I'm not the only one. And also maybe my own case is not even as difficult. And so it's kind of encourage each other, ask questions. How did you manage this? How do you manage taking them to the shops for their haircuts? And some children don't like haircuts. How do you manage to give medication? Some children don't like to take any medication. When they are sick, they won't tell you. So helping each other find all those little hacks that works, and you try and maybe helpful. So we find that community supportive groups like Autism Speaks, National Autistic Society UK, Autism Wales, several of them. I know we have a few in Nigeria as well. Just make sure parents are part of that and they're getting the support. So that's how we support autism. Basically, so there's no other specific medication. We can use medication for certain things. For example, some children's behavior are so serious that they are harming themselves, or they are at risk of harming themselves or others. So sometimes we may want to give something to deal with that as well, but that is most of the time we don't really have any specific medication. So I hope that's helpful. I decided to go into details because I know that's the most important question. Like, I know my child has autism. How do I manage it? How do I deal with it? So I hope that's help. And before I go for that, just to say, we don't ever say a child has outgrown autism. People wonder, okay, and I've seen parents come to us and say, can you now assess my child again that my child no longer has autism? No, we don't do that. Once we give autism diagnosis, it's for life. So a child who is autistic will always be autistic. They will overcome some of the difficulties. So we may have seen the child at the age of 2 or 3 when they are not talking, non-verbal, and then in 2-3 years they are talking, they are having conversation fine. Some children do not have learning difficulties and they're doing well in school. So they overcome, but at different stages, different challenges. Maybe when they're in teenage years, they may struggle with that teenage connection, having friends. Some of them have very good friends, maybe 1 or 2. No, they're not going to have so many, but different challenges at different stages. But we never say a child has outgrown autism. So people on the autistic spectrum are always going to be on the autistic spectrum, and many people are actually proud of being on the spectrum, being different. They don't see it as a disorder or as a disease or anything. It is a difference. I'm different, and they have their own what they call superpowers, things that people who are on the spectrum are very good at doing, that some of people who are neuro typical find difficult. So people tend to refer to them as neurodivergent and all that, but I don't want to go into all those jargons. But just for you to know that, because I know some parents will wonder, at what point are we going to now say the treatment is completed or the management is complete and the child is no longer on the spectrum? It's for life. We don't take it out. And just to say that. All right. Let me take this next question. My son of 3 can sing and read everything he watched on TV. So if a child of 3 can read everything, we call that hyperlexia. Usually most 3-year-olds cannot read, but sometimes you see children on the autism spectrum who cannot speak but can read. All right, that again is the inverse kind of situation we get in autism, and it's a red flag for autism spectrum. But it will not respond. So this child can read what is watching on TV, but that same child is not responding when you talk to to him. Is that a sign of speech delay or language delay? This is not a sign of speech delay or language delay. This is a child who may likely have autism spectrum disorder. So what I normally recommend for parents, if you pick up signs of autism, don't wish it away. Don't parents like to go for the softer or the maybe more acceptable and less stigmatized kind of possible option. And a lot of people will say speech delay, speech delay. Like I said last week, speech delay is just a descriptive term. It's not a diagnosis. It just say the child is not talking as respect for their age. It could just be an isolated thing. We know that what the child will eventually catch up and will speak, but sometimes it's part of autism, sometimes it's part of global developmental delay, sometimes it's part of other medical or developmental diagnosis. But what gives this child away from me is a 3-year-old who can read. That is a red flag. Most 3-year-olds do not read. And if a 3-year-old can read but is not speaking, is not responding when you talk to him, cannot have a conversation, that child is having red flag for autism. There are other questions, obviously, that we will need to ask. There are other observations we need to do to confirm the diagnosis. But even from this brief paragraph, I could see red flag of a child who is on the autism spectrum. So this kind of a child, you can usually the M-child screening is for children between 16 to 30 months. So the child is already above the age of M-child, but there are other autism screening tools available online that you can just answer a few questions and they will tell you, yes, your child is showing signs of autism and you need to see a developmental pediatrician for a full developmental assessment. Autism is not a diagnosis. You just tell us 1 or 2 lines and we give you a diagnosis. No, it's a diagnosis that we take time to give. We take time to get all the evidence, and the evidence has to be what we call multidisciplinary. It has to be pervasive. In other words, we need evidence from 2 or more places. So we need to know how the child is at home. We need to know how the child is in school or is in our clinic. We ask lots of questions and we're looking at the criteria for autism, what we call DSM-5 diagnostic criteria, or ICD-10 or ICD-11. Some people use different, but I use DSM-5. And you're checking the tick boxes from what the parents are telling you. And then you're also doing your observation, either informally or using other diagnostic tools like ADOS and all that. And you're also ticking the boxes. And you're also asking information from school, from other professionals, educational psychologists, speech therapists, everybody who has worked with this child. And you're putting all this information together and you're asking yourself, is the ticking all the boxes before you give a diagnosis? Because once you give it, you're giving it for life, you're not taking it back. So that is how we make a diagnosis of autism. All right. So the question next is, what causes autism? Short answer, we don't know. Short answer for parents, we don't know. But we know there is some genetic condition. We know there is some environmental condition that may be the cause of autism. For example, we know there are some genetic conditions that people who have those genetic condition tends to have autism. For example, people who have Fragile X syndrome, people who have Rett syndrome, people who have certain genetic conditions like that. And once they have those genetic conditions, the chances of them having autism is very high. So we know it's likely genetic. Unfortunately, we don't have any particular one gene that we're going to test for. So there are several hundreds of genes that has been associated with autism spectrum disorder. Another issue is it's 4 times more common in boys than in girls. So anything that has gender predisposition, we think there's some genetic aspect of it. So autism occurs 4 times in boys than in girls. And also we know that it runs in certain families. So I've seen families with all 3, 4 children who are on the spectrum. You know, some of them were able to pick out the genetic underlying, maybe there's a deletion of one chromosome or a duplication of one chromosome or something in places like UK where we do genetic tests like SNP arrays and stuff. But in Africa, most of us don't even do genetic tests for common stuff like Down syndrome. So we don't even routinely do genetic stuff for autism. Even for those in the UK, they don't do genetic tests simply for autism. It has to be autism with something else, autism with global developmental delay, or if there is like this family history, all the boys in the family having autism, all the cousins have autism, all the uncles have autism. Yes, we're going to do genetic tests. So we know there is some genetic thing. We know there are some environmental influence on autism. For example, we found that IVF babies tend to have more cases of autism. We don't know why. We figure out also something to do with age of parents and all that. These are all risk factors. So it doesn't mean that it is not cause and effect. So it doesn't mean that once you are IVF baby, you are going to have autism. No. Or once you are dad is elderly. No, it's just like we study and we find out that it's more common in this particular group, so it's a risk. We are not sure how it really happened, so we also find out that like twins that are what we call monozygotic twins, that mean identical twins, they tend to have autism. So I have several of my patients who are monozygotic twins and they have autism. And it's so interesting in twins because you see twins, identical twins, and they are there together within your room and they are not even having any kind of communication with each other. They are just in their own separate world. So we do have, those are the things that make us think autism is most likely genetic, but maybe with some environmental influences as well. The research is still ongoing, but we short answer for parents, we don't know. All right. How can it be prevented? No, we can't prevent autism. Again, things like this, when you don't know what is causing it, we don't know how to prevent as well. Okay, we can do just general things. We do making sure we do all the right things, making sure we go for your go for your antenatal care, deliver well, avoid any other brain injury, any issues. But the truth, because a lot of parents were asking me, is it possible to detect autism during pregnancy? Is it possible to prevent it? The short answer is no, we can't. We don't know who is going to have autism and we can't prevent it. For those who already have genetic diagnosis of the autism, for example, if there is a genetic diagnosis of autism in a particular child in that family, yes, we may be able to give you what we call prenatal diagnosis, do genetic tests for the baby in the womb and all that. But the question is, are you going to terminate the pregnancy or not? So apart from that, we cannot predict who's going to happen to in other people or when it's going to happen, and we cannot prevent this in pregnancy or anyhow. So what we normally do is, for condition that we cannot do what we call primary prevention, which is the question people are asking. Primary prevention is making sure the condition doesn't even happen at all. We don't have that capacity or that ability right now, but we can do what we call secondary, tertiary. Secondary prevention means the condition is there already, but we can detect it early and we can give support early so that the effect will be less. So we want to diagnose our children with autism from the age of 2 to 3. So American Academy of Pediatrics recommend that all the children should be screened at the age of 16 to 30 months, so that if we screen all our children, we can pick up those who have the red flags of autism and we can begin to work with them. So if a child is not talking, don't begin to say, oh, it's just speech delay, or the child will talk later. No. Take them to see a speech therapist. Let them start speech therapy. It doesn't matter whether it's autism or not. We're not going to lose anything. The first 5 years, the brain is so plastic. So any intervention we do at that age, we call it early intervention, it works and it will save us more money down the line. So it's easier to start treating a child at 2 than at age of 8. So when I was in Lagos University Hospital in Nigeria, I was diagnosing children with autism at age of 8, 9. Of course, this problem has been there before age of 8 or 9, but people were just waiting until the teacher starts saying what is going on, and we don't want. So that's when people come to seek for help. So we don't want that. We want the children to be picked up from age of 2. We want to start therapies before, around that age. We want to give them all the support so that by the time they are 25 and they are going to school, we want them to have, develop a lot of skills with their language, with their social skills, with their fine motor skills. We want all that in place. So such children tend to do better. We start with early intervention. So that is what we call secondary prevention. That is what we can do. And of course, tertiary is dealing with all the other complications. But I think let's just start with secondary. We can't do primary, but we can do secondary prevention. All right. The next question: how to stop repetitive behavior in my child with ASD? All right. So behavior, repetitive behavior is one of the core features of autism. It is part of autism. So sometimes we can't really always stop some of this behavior. What we try to do sometimes is to channel it and make it uh, help them to do it in a more controlled version and less disruptive version. For example, if a child likes to run up and down and jump up and down, we can give them a trampoline, we can give them a break, go just jump, burn off those energy, and then you come back. Sometimes we do distraction. So if they're doing something or what saying the same thing, you want to give them something else to play with or deal with. So it's about what is that repetitive behavior? Why is the child doing that repetitive behavior? Is this something sensory? Is this something is it they trying to regulate themselves and all that? So we try to work around that and see what we can do in a way. Sometimes we're not able to stop it, but we can at least help the child to still do that behavior, but less disruptive. And sometimes some children just outgrow those repetitive behavior on their own. They may stop one, maybe pick up another one, but they may eventually stop. And that is where the behavior therapists come in. We have behavior therapists, play therapists. They can help with that. So I recommend that your child can see one of them, but we can't always stop all the core features of autism. We can only manage all those things. All right. Thank you, Dr. Bemisola, for this opportunity. What can one do to a 6-year-old who is on the spectrum and tiptoeing? Okay, so walking on the tiptoe is also one of the stereotype behavior that we can pick up in children on the spectrum, and most of the children will walk on the tiptoes and then they will stop. So but some people, for whatever reason, they tend to continue. For a 6-year-old, that is really a bit persistent. So one of the things I recommend, like, let the child wear shoes. Some children, when they wear shoes, especially ankle boots, it helps them, keep the feet flat. So you can try that. Let them wear boots, especially ankle boots. And if their feet are flat when they're in their shoes, that's okay. So they can wear their shoes when they're awake, then when they sleep, they can take it off. That's one option. Option two, some children, even when they wear their shoes, they are still on the tiptoes. So sometimes the what we call the tendon Achilles are it's actually very tight. It's become shortened. And so sometimes we have to refer some of those children to our orthopedic colleagues, orthopedic surgeons, and they can do what we call a release. They can extend that tendon so that it will come down. So sometimes we have to do surgery. And so for children on the spectrum, we don't like putting them to sleep. We don't like putting them through anesthetics, but if we have to do it, we have to do it, because that's the problem. That's the challenge with surgery. So the first thing we do is try to wear them shoes, do some physiotherapy, help them massage. Just make sure just remind them. Some children just need a reminder. Can you walk on your feet? Can you keep your feet down? Just remind them and they will do it. Wear shoes, if it's really very tight and despite the fact that the child wants to do it, they can do it, and then we can send them to our orthopedic doctors for some surgical intervention. Yeah, so I think that's what is happening here. He said that it seems that the nerves at the ankles are now stiff. So this child obviously has developed what we call like a contracture. It's not the nerves, it's a tendon. It has become kind of shortened. So for those children, this child needs to see an orthopedic surgeon, and they can do some release of that tendon, and it will make it easier for the child to walk flat. All right. I read for every child diagnosed of ADHD, most likely one of the parents is undiagnosed. Is this true? Okay, this is actually an ASD Q&A session, but because ADHD is one of the most common comorbidity of ASD as well, I will just answer that question in passing. The answer to this question is it is not true. Every child with ADHD does not have a parent who has ADHD. That is really a very too generic statement to make, and it's actually not true. Yes, I understand where they are coming from. ADHD tends to run in families, and so it is possible for a mother and to have ADHD and their child also has ADHD. It can happen, but it is not 100%. It's not 100% every father, every mother who have ADHD must also have a child who has ADHD. No, it is not true. I've seen some of my parents who, when we're doing the assessment for the children, and then they are also thinking, I think I was like him when I was this age. I also think I have ADHD. I actually have parents who actually have ADHD. They are also on medication, and we're now doing the assessment for their children as well. So it happens, it's common, but it is not 100% that they must have ADHD. Okay. Next question say I heard childhood immunization is responsible for autism. That is not true. Okay, we have debunked that. I know somebody, one of our doctors, came up and said, oh, MMR may be related to autism, and because of that, a lot of parents stopped taking MMR vaccine. Currently, as I'm talking to you now, we have an outbreak of measles in the UK, in Wales specifically, and that's because a lot of people stop taking MMR because they are scared of MMR causing autism. And in places like UK, where you don't even hear of things like measles and stuff like that, we are not having outbreaks. So please, that is not true. That has been put to rest. Researchers have done extensive research. We have put to rest that MMR vaccine or any vaccine whatsoever does not cause autism. You know, I have loads of parents who, because of this, they didn't give their children MMR vaccine, and the children still have autism. Okay, so they come to me and I ask, immunization history is one of the things we always ask you for any reason you are seeing a pediatrician. And they're like, oh, doc, I've not given my child MMR vaccine. I decided to wait because I think because I give MMR to my other child, that's why that one has autism. So they've not given this particular one MMR. And yes, we're doing an autism assessment. So it is not true. So MMR is not the cause of autism. Lots of children who are not given MMR have autism. So there is no link with it. And people, extensive research, you can do your own Google research online, but I can tell you for free that we have laid that doubt to rest. MMR vaccine has nothing to do with autism, or even giving your children multiple vaccines. Some people believe that if you take too many vaccines in one day, the child is at risk of autism. It is not true. All right. So I hope I've debunk that. So another question: how can you handle ASD in an adult of 22 years old? So adults can also have autism. Very violent, quick to anger, destructive. So first thing I want you to see is psychiatrists, and they are the one that will handle adults on the spectrum. And first, you have to be sure this adults actually have ASD, because being violent, anger, and destructive does not necessarily mean the person has autism. You have not actually said anything about autism in this list. Okay, none of them are features of autism, so that is just a behavior issue. But yes, I agree with you. The person can have autism and not have behavior issues, but please see the professionals first. Let them do an assessment. Let them confirm that this person has a diagnosis, and then they can manage the behavior. Sometimes they may even have to use medications, but they can do it. All right. Down syndrome, you see the same thing with autism? No. So I've already done a teaching on Down syndrome. For those of you, 2 weeks ago or 3 weeks ago was the Down syndrome week, and we did have a discussion, ACP hour on Down syndrome. So I encourage you to read that or watch that or listen to that, whichever one you prefer. But definitely Down syndrome is not autism. And a lot of parents, I got this question also on the Super Parents Foundation Facebook group, and a mom was asking whether all children with Down syndrome always have autism. The answer is parents know. Most of my parents, most of the kids I manage for Down syndrome, they don't have autism. Majority do not have autism. Of course, some can still have autism, but it is not. So please, like I always say, most of our developmental diagnoses, they sometimes have overlapping features. For example, children with Down syndrome most often have developmental delay. They may be slow to talk, they may be slow to do things, and they may also have some behavioral issues as well. That does not necessarily make it autism. Okay, so Down syndrome, cerebral palsy, autism, they can all have speech delay as a feature, or developmental delay generally as a feature, but there's a way we do assessment and we will make the difference, which is why I always don't like parents giving them their children labels before you see a pediatrician for an assessment. And I don't like you taking labels because some people are so ignorant, but also proudly ignorant. And once they see a child with a special need or a child with additional learning needs, then they just begin to label them Down syndrome. And I think Down syndrome is a favorite of many of them, you know, and they just label every child with Down syndrome or cerebral palsy, you know, just because the child cannot talk or the child is not yet walking or something. No, it is not. So please don't take diagnosis from people. Don't ever take it. Don't ever let anyone label your child for you. And please don't label your child as well. If your child cannot do anything or has any developmental issues or developmental delay or milestones, difficulties in achieving any milestone, please don't label them first. Take them to the pediatrician, preferably a developmental pediatrician or pediatric neurologist. Those are the specialists that are trained to do those assessments and make those diagnoses. And then we will tell you, this is Down syndrome, this is autism, this is cerebral palsy, this is global developmental delay, this is intellectual disability. There are many, many of our conditions. Granted, they can coexist in the same child, but they are different and they are not the same. All right, so next person say, how will I know if a child is autistic? So you have to watch last week's episode because I gave the traits, the features that you will see that will make you think, is this child having features of autism? So there are two big criteria. Number one, they all have social communication and interaction difficulties. So they may not give eye contact. They may not be responding to their name by age of 9 months. They may not show facial expression like happy, sad, angry. You know, they just look the same or blank. You know, they may not play simple interactive games like peekaboo, hide and seek. They may not use gestures. They may not share things with other people. They may not point. They may not point to show things. You know, they may not want to play with other children. You know, they may not do any of those things. So these are red flags. It doesn't mean the child has a diagnosis, but these are flags that will make you think, could there be autism going on? Or they may have all this repetitive behavior, lining up toys, repeating words, you know, echoing whatever everybody is saying. They may play with the same toy every time. They may become obsessed with certain things. They want to hold it all the time. They will get upset with changes. They may, you know, want to follow routine, flap their hands, rock, spins, all those unusual things that they may sometimes do. So if you see this thing, don't say the child has autism. It just means you are seeing traits that may suggest that this child may be at risk of possible autism. So what you need to do, you can do some screening online. If it's a child less than 2.5, you can do like the MCHAT screening, or there's some other ones as well. But more importantly, you need to see your pediatrician or your GP, or your head visitor, depending on which country you are and the service there, and then they can refer you to the specialist who does the assessment, usually the developmental pediatrician, clinical psychologist, speech therapist. We do those assessments and we can confirm the diagnosis. So the parents can identify the features that have concern, but the child has to be referred to the specialist for the assessment. All right. Can autism be detected in a newborn? No. Are there early signs a mother should watch out for? The same signs I've mentioned about, but not in the newborn period. Most time you begin to see them from around 6, 7 months, 9 months old. The parents who have had children on the spectrum before, I found out that they have this razor intelligence, this ability to pick up features of autism. I've seen parents who have told me they know their children are on the spectrum from as early as 6 months. Well, we even pediatricians, we don't think that far. So usually for us, we begin to worry from about 9 months to 10 months. But even then, most time we tend to wait until they're about 18 months, 2 years before we begin to do very serious assessment for them. All right, my time is running. Okay, let me just answer a couple more questions. For a 5-year-old who reads rhymes, sings, and mimics a lot, he also reads and solves maths, but cannot communicate his wants or needs. Can it be timed as non-verbal? If a child is not talking at all, that is, then we'll say the child is non-verbal, but you said the child is reading, so I won't classify that as a child who is non-verbal. If a child can read and is saying all the words, that will not be classified as non-verbal. But this child is definitely showing signs of autism. As much as possible, we just like to say everybody is on the autism spectrum. We try not to use all the, I know we tend to use those jargons, non-verbal, high functioning, all those things for slangs and for fast way of communicating, but it's actually not right. We should just say everybody is on the spectrum. All right. Good day. My autistic child of 12 years is largely dependable. Is there hope of doing things on his own? Yeah, there's always hope. One thing we always do is to give parents hope. I've seen parents who told me their child did not speak until they're 6 years old. I've watched videos of adults now who are now motivational speakers who told us they didn't speak until they're 12, or even some as late as maybe 15, 20, so these things happen. So as parents, we must never lose hope. We must always support our children, and our children surprise us all the time. So we as pediatricians will never tell you there's never hope. So your child needs help, definitely. Your child will need support of the therapists, occupational therapists, speech therapists, behavior therapists. Just make sure you're giving the child all the support. And the thing with parents sometimes is that we get tired of therapies, because sometimes parents are looking for quick fix. Unfortunately, therapies are not like something you give for 3 days or 1 month and everything will be fine. Therapies takes years. We do it for years, and sometimes you don't seem to see any change, but you have to keep doing it until you begin to see the big change. Sometimes there are only small changes which will eventually accumulate to give the big one. So we must never we must never give up hope. We must always make sure we give our children the right support. All right, I'm going to answer the last question because my time is up. Can an autistic child live a normal life without support in the future? The answer is yes. Very, very possible here. So I know a lot of autistic or neurodivergent people who are professor. I think there's a Professor Trempo Grande. You should just Google autistic people, who are celebrities. So we know a lot of autistic who are professors, a lot of autistic who are doctors. We have beauty queens who are on the spectrum. We have lots of our millionaires and richest people in the world who we suspect may be on the spectrum. I'm not going to mention names. You can work it out for yourself, but just Google that. So a lot of people who are on the spectrum are living normal, depending on what you call normal. So in other words, I get what you meant is that can they work, go to work, have their own family, have their wife, have children? Yes, a resounding yes. Live a fulfilling life. I know doctors, I know pastors, a lot of people on the spectrum. That is first thing I'd like to say. Of course, like I said, it's a spectrum, so there are people who will not be able to live like that. There are people who will still need support, but we will be able to support them, and you can still live a normal life even with the right support. That is so that's why I say it depends on what you call normal. So but the truth is that autism does not mean somebody cannot be anything they want. There are authors, a lot of people who are doing well, and despite having autism spectrum disorder. I still have lots of questions, but my time is up. But thank you so much for listening to me. But like I said, if you still have questions and you want to clarify about autism spectrum disorder, feel free to go over to our Facebook group, Ask Pediatrician Facebook group. Put your questions there. Myself, my colleagues will be there to answer your question. Until I come your way again next week, same time, same place, where we'll be talking about another important topic that has to do with the health of our children. It is me saying bye, and keep lighting it up blue for autism spectrum disorder. Bye-bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.